Hello viewers, good day to all of you. This is Dr. BK for you with a very interesting topic, that is the brachial plexus. The brachial plexus is an interesting and also a very important topic. Why? Because it is through this brachial plexus the whole of the upper limb is innervated. So that is the principal nerve supply to the brachial plexus. Principal nerve supply to the upper limb is mainly through the brachial plexus. So our learning objectives for today will be a short introduction on the brachial plexus, followed by the situation where actually the brachial plexus is situated, then how it is formed. Very importantly, we will be discussing about the formation of the brachial plexus, the branches of the brachial plexus, and definitely we will be finishing off with the applied aspects, that is the various injuries or damages to the brachial plexus. Okay, now first of all let us understand what is a plexus. So plexus means braid, or Latin it is called as a braid. So what is a braid or plexus? Means you all know how you plait our hair. So the girls who actually do a long plait, that is actually called as a plexus. So any plexus means when there is an intercommunication between the structures. So in our body we have plexus, venous plexus, capillary plexus and nerve plexus. But what's the difference between these? Now usually capillary plexus, even we have arterial plexus, venous plexus, they are all not much disorganized. There is some intercommunication between these arteries, but this plexus is not very well organized or designed. We won't be able to make out all the branches. We can just simply analyze what are all the arteries taking part in it, but then how do they form the branches, and all those things will not be very difficult, especially in the case of the venous plexus. Okay, so coming to the nerve plexus also, what happens is they form an organized pattern, and that too only in the spinal nerves, because the spinal nerve plexus in our body, what we have is the brachial plexus, cervical plexus, lumbar plexus and the sacral plexus. There are also other plexus formed by the nerves, like the sympathetic plexus. So this sympathetic plexus mostly will be formed around the arteries or blood vessels. Again, they are not very much organized. It will be some tangling of structures. You also have parasympathetic plexus, which is again found near the viscera, which it is going to innervate. Even that it is very difficult to understand. Only theoretically you can appreciate, but practically you cannot appreciate the sympathetic plexus or the parasympathetic plexus. Okay, now this nerve plexus of the spinal nerves, they form a uniform pattern, which means two or more nerves, they unite, then afterwards what happens is they divide, they reunite, and ultimately they give branches which is going to go and supply the target structures. So here is a schematic representation of the spinal cord. You are able to see here. So the length of the spinal cord starting from the first cervical, and here it ends like a cone, which is called as the conus medullaris. Now here again you are able to see the spinal cord shows two enlargements, which is the cervical enlargement and the other one is the lumbar enlargement. Now why actually it shows enlargement at these two sites is because there is a lot of white matter present here, and that is responsible for the innervation of your limbs. That is the upper limb in case of the cervical enlargement and the lumbar enlargement in case of the innervation of the lower limb. So I need not tell about the number of cervical, thoracic, lumbar and sacral nerves. So totally there are 31 pairs of spinal nerves. This I have already mentioned in the introductory lecture to the nervous system. So directly we will move on to a little bit about a recap of the spinal nerves, how they are actually formed. We all know that a typical spinal nerve is actually formed by the union of the dorsal root and the ventral root. So both the roots, they unite at the intervertebral foramen and they come out as a one single spinal nerve. So the dorsal root again bears a ganglion which is actually called as the dorsal root ganglion. Is that clear to you? So this is the dorsal and the ventral root. Dorsal root carries the sensory information, whereas the ventral root carries the motor information. When both these roots unite at the intervertebral foramen and they emerge as a single nerve, spinal nerve, or a typical spinal nerve. The typical spinal nerve now consists of both the sensory as well as the motor fibers, and they actually divide into two, that is the ventral primary rami and the dorsal primary rami. Okay, so this is ventral and dorsal root, whereas this is the ventral primary rami and that is the dorsal primary rami. Now only the ventral primary rami is involved in the formation of the plexus. I repeat, only the ventral primary rami is actually involved in the plexus. So the ventral primary rami can also be called as the anterior primary rami. So this ventral primary rami, in case of the thoracic spinal nerves, they are called as the intercostal nerves. The other nerves, what happens is, they are simply called as C1, C2, C3 in case of cervical, then S1, S2, S3 in case of sacral, L1, L2 in case of lumbar, and so on. So each of the rami, as they supply the structures, so mainly they supply the body wall, the muscles, fascia, skin and joints, all those things they supply. They might give out branches throughout their course. Okay, so that is why we are discussing mainly a little bit on the ventral primary rami, and that is how they are going to form the plexus. So here you are able to understand the plexus is actually formed in the posterior triangle in the neck region, and from there what happens is they enter the axilla through a small opening which we have already discussed in our axilla class. So that is the cervico-axillary canal, a narrow space through which it comes, and it also drags a layer of the fascia along with it, which is the deep cervical fascia. So that facial prolongation into the axilla is again called as the axillary sheath. Okay, so now you might wonder, or one natural question should occur into your mind, why plexus? Why not the nerves themselves descend and supply the upper limb directly? So one main reason is for the want of space. So within this small space, what happens is these nerves along with these vessels, the brachial artery and of course the veins and some lymphatics, everything is going to pass from your trunk and going to enter into the limb. So these ultimately this brachial plexus is going to give so around 10 to 15 branches. Now just imagine if these 10 to 15 branches directly arise as branches from the spinal cord, how much space they would need or they would get occupied. So they might occupy a large amount of space. So that is why the need for the plexus arises. 2-3 nerves they join, and then ultimately what happens is once they cross that narrow area, they actually divide into many branches and innervate the target structures. Okay, so now coming directly to the brachial plexus, where actually the plexus is situated. So here you are able to see on the side of the neck you have an area which is called as the posterior triangle, so which is highlighted for you. So in the posterior triangle the brachial plexus arises. So that is the starting or the roots of the brachial plexus arises. Between certain muscles here, they are actually called as the scalene muscles. Okay, so scalene is anterior, then you have the scalenus medius and posterior. So between the scalenus muscles, between the anterior and the medial muscles, what happens? The trunks of the brachial plexus emerge from the posterior triangle. Okay, so that is here for you. All the structures has been removed and you are just seeing the nerves. So these nerves are going to form, or they are responsible for the formation of the brachial plexus. So they take part, that is the 5th, the 6th, 7th and 8th cervical nerve, and the first thoracic nerve. These 5 nerves take part in the formation of the brachial plexus. So these nerves, they are going to unite, divide here in the very narrow area, and ultimately they give the branches which is going to supply your upper limb. Okay. So the upper part, as I told you, situated in the posterior triangle of the neck. Then they pass to the cervicoaxillary canal, and the lower part of the plexus is actually situated in the axilla. So now coming to the parts of the brachial plexus. So here you will be able to appreciate it consists of the 5 parts. The root stage, then you have the trunk stage, then you have the division stage, then you have the cord stage, and finally what arises is the branches. Now again, I would like to make one thing clear is, so branches means don't think they only arise only at the end from the cords. Even branches are given at the root stage and also at the trunk stage also, but not at the division stage. Okay, so I repeat for you. So there are 5 stages in the formation of the brachial plexus: the root stage, the trunk stage, the division stage, the cord stage, and finally the branch stage. Okay, first we will see the construction of the brachial plexus stage by stage. So the first stage, what you see here is the root stage. So the roots are the spinal nerves. Again, I would like to stress here, that is the ventral primary rami of these 5 following spinal nerves are involved in the roots of the brachial plexus. That is the ventral primary rami of C5, C6, C7, C8 and T1. So these are the roots of the brachial plexus. Now, sometimes, not always, but sometimes there might be a shift in the contribution of the brachial plexus, one segment above or one segment below. Now in case if the C4 nerves comes to contribute the brachial plexus, then it is shifted one segment above and it's called as the prefixed plexus. So in that case it starts as C4, C5, C6, C7, C8. T1, there might not be any significant contribution from the T1 and it might be reduced or totally absent. In the same way, the opposite also might occur. That is, what happens is the segment might be shifted one segment below. In that case, the plexus is actually called as the postfixed plexus, which means the contribution from the T2 will be there and the contribution from the C5 will be reduced or completely absent. So is it clear to you was the prefixed plexus and what about the postfixed plexus? So now we have seen about the roots of the brachial plexus. Next, coming to the trunk stage. So the trunk stage is mainly formed. There are 3 trunks in the brachial plexus. The one is the upper trunk, the other one is the middle trunk, and other one is the lower trunk, which can also be labeled as the superior trunk, the middle trunk, and the inferior trunk. Now, the C5 and C6 root unite to form the upper or the superior trunk. The C7 does not unite with any other spinal nerve and it continues unanimously as the middle trunk. The C8 and T1 nerve again unite to form the lower trunk. Okay, so the upper trunk is the union of C5 and C6. C7 alone passes as the middle trunk. C8 and T1 unite to form the lower trunk. So now we are moving on to the next stage, that is the division stage. So we finished with the roots of the brachial plexus. Then we have seen about the trunks of the brachial plexus. Now we are coming to the divisions of the brachial plexus. Now coming to the division of the brachial plexus, each trunk in turn divides into 2, an anterior and a posterior, an anterior and a posterior, an anterior and a posterior. Okay, so remember, each trunk again divides into an anterior and posterior division. All the trunks divide in the same way into 2, that is the anterior and the posterior. So now, followed by the division stage, we come to the cord stage, which is very important. Okay, so listen carefully. because a little bit confusing while actually determining the chords. Now, there are three chords you are able to see here. One is actually called as a lateral chord, the other one is actually called as a medial chord, and the last one which is actually called as the posterior chord. I repeat, there are three chords in the brachial plexus. One is the lateral chord, other one is the medial chord, and other one is the posterior chord. So the lateral chord is actually formed by the anterior division of the upper trunk and the anterior division of the middle trunk. I repeat, the lateral chord is actually formed by the anterior division of the upper trunk and the anterior division of the middle trunk. The medial chord, here we are able to see the medial chord is actually formed only by the anterior division of the lower trunk. Okay, anterior division of the lower trunk alone passes as the medial chord. Very easy. Next one, the posterior chord is the union of all the posterior divisions of the three trunks. So the posterior division of the upper trunk, the posterior division of the middle trunk, the posterior division of the inferior trunk. All three divisions, what do? They unite to form the posterior chord. Okay, so that is how the three chords, that is the lateral chord, the medial chord, and the posterior chord is formed. Okay, so a recap of the formation of the brachial plexus once again for you. The root stage, it is mainly formed by the ventral primary rami of C5, C6, C7, C8 and T1 spinal nerve. C5 and C6 unites to form the upper or the superior trunk. C7 passes alone as the medial trunk. C8 and T1 unites to form the lower or the inferior trunk. Each trunk again divides into two divisions, anterior and the posterior division. So all the three trunks, they actually divide into anterior and the posterior division. The chords are the three chords, the lateral chord, the medial chord and the posterior chord. The lateral chord is actually formed by the union of the upper trunk and the middle trunk. The medial chord is formed only by the anterior division of the lower trunk or the inferior trunk alone. The posterior chord is actually formed by the union of all the three posterior divisions. The posterior chord is mainly formed by the union of the posterior divisions of all the three trunks. And finally, what happens is, from these chords, the branches arise. So they might be the branches of the lateral chord, they are the branches of the medial chord, and the branches of the posterior chord. Okay. Now, as I told you, whether you remember that branches means they are not strictly arising only from the chord stage. There are also branches which are given from the root stage as well as the trunk stage. So we will see the branches from the root stage. First branch is the dorsal scapular nerve or the nerve of the rhomboids. So which is going to supply your rhomboids minor and rhomboids major muscle. Then it is going to give a small contribution to the phrenic nerve. So the phrenic nerve is the nerve which is the motor supply to your diaphragm. So the spinal nerves which are involved in the formation of the phrenic nerve is the third, fourth and the fifth cervical nerve, C3, C4 and C5. So the C5 is actually derived from this root part of the brachial plexus. And of course, the very important branch which we will be seeing in the upper limb is the nerve to serratus anterior or the long thoracic nerve of Bell, which is given by the roots of the C5, C6 and C7. Then it is also giving a small branch to a longus colli and scalene muscles in the neck. They are actually the prevertebral muscles, that is the muscles which are present immediately in front of the cervical vertebra. Okay, so here you are able to see the roots C5, C6, C7, C8 and T1 roots. From the C5, the dorsal scapular nerve. So naturally, since it is from the C5, the root value is going to be C5 for this nerve. So this is going to supply your rhomboids major and minor. So that's why it is actually called as the nerve to rhomboids. Then C5 from the root stage also gives a small contribution to the phrenic nerve I told you, which is going to supply the diaphragm. So the root value of the phrenic nerve is going to be C3, C4 and C5, of which C5 alone is contributed from the root stage of the brachial plexus. Then the roots of the C5, C6 and C7 is giving a contribution to the formation of this nerve, which is actually called as the long thoracic nerve of Bell, or the nerve to serratus anterior. So this you can see, which is descending along the lateral wall of the thorax on top of the serratus anterior muscle, and this also we have discussed while we were discussing with the medial wall of the axilla, which is formed by the serratus anterior muscle and upper four ribs with its intercostal muscles. Okay, so branches from the roots, again I repeat: dorsal scapular nerve, a branch to the phrenic nerve, the long thoracic nerve, and of course a small branch to the longus coeli and the scalene muscles. Next, so what happens if the long thoracic nerve of Bell is actually damaged? Then naturally the serratus anterior muscle won't be able to contract, and it leads to a condition called as the winging of scapula, which means the serratus anterior is actually paralyzed. So when you try to push or punch with your arm, when you use your hand for pushing or punching movements, what happens is the medial border of the scapula is raised. It is not opposed to the thoracic wall. Okay, why? Because the nerve is paralyzed, the muscle is not acting, the serratus anterior, which involves the protraction of the scapula. And this border becomes raised because the muscles which are attached to this border, that is the rhomboids major and the rhomboids minor, and trapezius, which is attached here to the spine, they all become unopposed, and they are retractors of the scapula. So naturally they try to retract the scapula. So no protraction is occurring, and naturally what happens is the medial border of the scapula is raised, and that condition is actually called as the winging of scapula. The next, from the roots, we move on to the branches to the trunk stage. Two branches arise from the trunk of the brachial plexus, and both are from the upper trunk of the brachial plexus: the nerve to subclavius and the suprascapular nerve. So this is actually the trunk stage, the upper trunk, which is mainly formed by the C5 and C6 roots, which gives two branches: the suprascapular nerve and the nerve to subclavius. So you know that the nerve to subclavius is going to supply the subclavius muscle, and it is also going to innervate the acromioclavicular joint. The other one for the upper part of the upper trunk is the suprascapular nerve, which is going to innervate your supraspinatus and the infraspinatus muscle, which is present on the dorsal aspect of the scapula. Okay, so since these two nerves are arising from the upper trunk, and upper trunk is actually formed by C5 and C6 roots, so thereby they derive the root value for these nerves C5, C6 in case of suprascapular, and nerve to subclavius is also C5, C6. So branches of the brachial plexus. Here, since we are dealing with the upper trunk, there is a point which is actually called as the ERB'S point. So now you are able to see, which is circled or highlighted for you. The ERB'S point is actually a meeting point of 6 nerves. So let us understand how the 6 nerves comes. The roots C5 and C6, 2 nerves. Then the trunk dividing into the anterior and posterior division, 2 nerves. 1 nerve, 2 nerve, 3 and 4. Then from the trunk you get 2 branches, 5 and 6. So 1, 2, 3, 4, 5 and 6. 6 nerves are actually meeting point of this, and it is actually called as the ERB'S point. So, okay, so we will come again what happens if there is an injury to this ERB'S point at the later part of this lecture. So it's a meeting point of 6 nerves. So now we will go to the branches from the cord stage. So far we have discussed about the branches from the root stage, the branches from the trunk stage. So now we'll go to the branches to the cord stage. So the branches of the cord, first we are starting with the lateral cord. So can I just recollect how the lateral cord is formed? The lateral cord is formed by the anterior division of the upper trunk and the anterior division of the middle trunk. So anterior division of upper trunk is C5 and C6, middle trunk C7. So all the nerves arising from the lateral cord is going to have the root value as C5, C6 and C7. So the branches are the lateral pectoral nerve, musculocutaneous nerve and the lateral root of median. Lateral pectoral nerve, musculocutaneous nerve and lateral root of median. So you are able to see the lateral root of median. So as I told you, all have the root value as C5, C6 and C7. So this is an enlarged view where we are able to appreciate the lateral pectoral nerve, which is going to supply pectoralis major and minor. Musculocutaneous nerve is going to supply your coracobrachialis muscle, biceps brachii and the brachialis muscle. Lateral root of median is actually going to join the medial root to form the median nerve. This is medial, lateral root of median. Medial root of median will join to form the median nerve. So we'll move on to the branches of the medial cord. 5 branches: medial pectoral nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, ulnar nerve and medial root of median. I repeat, medial pectoral nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, ulnar nerve and medial root of median. Okay, so that is here for you the medial cord. The medial cord is actually the anterior division of the lower trunk. So the anterior division of lower trunk alone does not join with any other and forms the medial cord. So I told you anterior division of lower trunk. So the lower trunk itself is formed by C8 and T1. So that's why naturally all the branches of the medial cord will have the root value of C8 and T1. Okay. So the branches for you here, you are able to see, that is the medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial pectoral nerve, the ulnar nerve, the terminal branch of the medial cord and medial root of median joining with the lateral root of median to form the median nerve. So I repeat, branches from the medial cord are medial pectoral nerve, medial cutaneous nerve of arm, forearm, ulnar nerve and medial root of median. Next, coming to the branches of the posterior cord, again 5 branches from the posterior cord: upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve or nerve to latissimus dorsi, axillary nerve and the radial nerve. Now here, understanding the root value of all these nerves, unlike the lateral cord and the medial cord, here the root values, they don't actually coincide with the formation, because what happens is the posterior cord is a union of all the divisions, posterior divisions of all the 3 trunks. So naturally, not necessarily all the roots should contribute to the formation of these nerves. So based on the various studies and research, they have found out the root values are only contribution from these specific nerves. For the upper subscapular, the lower subscapular and the axillary, it is C5 and C6. Upper subscapular nerve will supply the subscapularis muscle. Lower subscapular nerve will again supply the subscapularis and it will also supply the teres major muscle. Thoracodorsal nerve, it's going to supply your latissimus dorsi, which has a root value of C6, C7 and C8. Axillary nerve is going to supply your deltoid muscle and the teres minor muscle. And of course the radial nerve, where it logically coincides, since it is the union of all the posterior division of all the 3 cords, C5, C6, C7, C8 and T1, and which is also the largest and the thickest branch of the brachial plexus. So branches from the posterior cord, 5 branches you are able to see: upper subscapular, thoracodorsal, lower subscapular, axillary, and the radial nerve. The largest and the thickest branch is the radial nerve from the posterior cord of the brachial plexus. So upper subscapular nerve and lower subscapular nerve and axillary nerve have the root value of C5, C6. Thoracodorsal nerve has the root value of C6, C7 and C8. And axillary nerve has the root value of C5, C6, C7, C8 and the T1 nerve. So we are finished with the structure or the formation of the brachial plexus. Okay. So now you can see all the branches from the cord stage: lateral cord, lateral pectoral, musculocutaneous and lateral root of median. Medial cord, medial pectoral, medial cutaneous nerve of arm, forearm, ulnar, medial root of median. Posterior cord, upper subscapular, thoracodorsal, lower subscapular, axillary nerve and the radial nerve. From the trunk stage, 2 branches: suprascapular and nerve to subclavius. From the root stage, only in this view you are able to see the long thoracic nerve or nerve to the serratus anterior. Now we are coming to the injury of the brachial plexus. The first type is called as the ERB'S paralysis. ERB'S paralysis is injury to the upper trunk of brachial plexus, so which is the C5, C6. When actually this takes place? When your shoulder is separated away from the neck due to traction, mainly during parturition in babies. In the babies, what happens is during the parturition, if you try to separate the neck from the shoulder while bringing out the baby, then naturally what happens is there might be stretching of these nerves, and in most severe cases it might go to the nerve avulsion. That means the nerve completely separating out. That is in case of the babies. Even in case of adults, if you look at it head on fall, when you fall from a height, when you land with your shoulder, so when there is an undue separation of your neck from the shoulder, when it is stretched too much, then naturally what happens is the upper trunk of brachial plexus gets damaged, and the damage is at the ERB'S point. Do you remember few slides back I showed you what is the ERB'S point? It is actually the meeting point of the 6 nerves. So in ERB'S paralysis, what happens is the arm is adducted and hanging by the side. The elbow is extended. The arm is adducted, the elbow is extended and pronated the forearm. The forearm is pronated and medially rotated. The wrist and the fingers are flexed. The wrist and the fingers are flexed. Why? Because the extension is weak. So there is no extension of the elbow. The extensor muscles become very weak. Because of the unopposed extension, the wrist and the fingers, they get flexed. Forearm is pronated, so there is no supination. Arm is adducted, no abduction, because what happens is the deltoid muscle is paralyzed. Axillary nerve C5 and C6, and it assumes a waiter's tip or a policeman's tip. That means the waiter or a policeman, when he is actually prompting for a tip, so that is why it is called as a waiter's tip or a policeman's tip. This is actually called as ERB'S paralysis or ERB'S palsy. Palsy refers to weakness. Paralysis refers to total absence of nerve supply to the muscle. So that is ERB'S paralysis. The next type is the Klumpkey's paralysis. In the Klumpkey's paralysis, it is injury to the lower trunk of brachial plexus. In the lower trunk of brachial plexus, if it is damaged, one case is the breech presentation. Again, in the babies, what happens during birth? In the breech presentation, if you try to give too much of traction to the limb while pulling out, then the lower trunk of brachial plexus is involved. Then, when you fall from a height, when you try to grab a tree during your fall, or a lamp post, when in a road traffic accidents, motor accidents, the lower trunk of the brachial plexus gets damaged. The lower trunk is C8 and T1, so naturally your ulnar nerve is going to get damaged. In that case, you get a claw hand deformity. So in the claw hand deformity, what happens is loss of sensations, mainly to the intrinsic muscles, not sensations, the muscles, the short muscles of the hand, small, the palmar interosseous, dorsal interosseous, and medial to lumbricals, they all get paralyzed. Loss of sensation on the medial border of your arm as well as your forearm, that is along the distribution of the ulnar nerve. What happens is you see this damage, and most commonly the classical picture is the ulnar claw hand. Okay, so this is actually the ulnar claw hand which you are able to see. And Horner syndrome, because the sympathetic fibers to the T1 is damaged. So if you remember the structure of the spinal nerve, each spinal nerve is again connected to the sympathetic trunk by two roots, gray and white rami communicants. So the sympathetic ganglion of the T1, lower cervical ganglion, and the T1 ganglion, they are involved in the sympathetic supply to the upper limb. So if Horner syndrome, if you see, then naturally what happens is lower trunk of brachial plexus also is involved. So I will tell you what are the symptoms of the Horner syndrome. Ptosis, that is the drooping of the eyelid takes place. Then anhydrosis, that is sweating might not takes place, anhydrosis. Then loss of ciliospinal reflex. Okay, so if you instigate a pain on the neck, then naturally what happens is your pupil should dilate. This is actually called as ciliospinal reflex. So when all these symptoms are seen, then naturally it is called as Horner's syndrome, that might be due to the involvement of the lower trunk of brachial plexus. Otherwise what happens is Klumpkey's paralysis is mainly claw hand you come across in the lower trunk of brachial plexus with respect to the upper limb. The next type of injury which can be caused to the brachial plexus is due to the cervical rib syndrome. Now, the ribs are all what you see here, they are the costal elements. In the thoracic region, they are elongated, but in the upper cervical region, what happens is the costal elements is the transverse process, they get regressed or shortened. Sometimes the C7 might be unusually long, it fails to regress. Or sometimes a fibrous band might connect this long process with the first rib. So naturally the lower trunk of the brachial plexus might get compressed due to this excessive pressure. And naturally what happens is you might have nervous symptoms, pain, tingling sensations over the arm, shoulder, or if there is vascular symptoms, if the blood vessels are compressed, then you might have edema of the arm due to ineffective venous return. So pain over your upper limb, you might not be able to lift your arm and perform some activities because it might compress these nerves. Here you are able to see it might be because these nerves might get compressed or these vessels might get compressed in a cervical rib. So this is mainly due to one more symptom even in the thoracic outlet syndrome. So in the thoracic outlet syndrome, again these nerves might get compressed or these vessels might get compressed, maybe due to the cervical rib, or sometimes what happens is cancers or tumors or metastasis from the upper part of the lung. So cancer or tumors of the upper part of the lung might compress these vascular or nervous structures, and that might also lead to pain along the distribution of these nerves to the upper limb, especially over the arm and the shoulder. That is called as the thoracic outlet syndrome. So apart from that, there are also other syndromes or damage to the brachial plexus like backpacker's palsy. So people who carry heavy weight, they put undue pressure on the shoulder, and that might compress the nerves of the brachial plexus. And there are also other palsies
but those palsies we will be discussing when we are going to deal with that individual nerves of the upper limb. So with that, today we have discussed about the construction of the brachial plexus and also the various damage to the trunks of the brachial plexus. So we will meet again in some other lecture. Thank you very much.